Did you know that your feet can reveal critical signs of diabetes complications? It's true. Our feet often show early warning signs of problems that, if left unchecked, could lead to serious issues. Diabetes affects the entire body, but the feet are particularly vulnerable due to how the condition impacts nerves and circulation. Small changes like numbness, pain, or slow-healing sores can signal much bigger health risks down the road. If these signs go unnoticed, they can lead to infections or, in severe cases, even amputations. But the good news is, if you know what to look for, you can catch these issues early and work with your healthcare provider to prevent complications. In today's video, we'll walk you through the key signs your feet might be showing you about your health. Stick around, because understanding these signs could make all the difference. Sign number 1. Numbness or tingling. Numbness or tingling in the feet is one of the most common early signs of diabetic nerve damage, also known as diabetic neuropathy. When blood sugar levels remain elevated over time, they can damage the nerves, especially in the extremities like your feet. This can result in sensations of pins and needles, or sometimes a complete lack of feeling altogether. The problem with this is that when your feet are numb, you might not notice small cuts, blisters, or even pressure points caused by tight shoes. Because you don't feel the pain, these minor injuries can go unnoticed and untreated for too long. And since diabetes also affects blood circulation, wounds take longer to heal, which increases the risk of infections. What starts as a small cut could easily develop into something more serious, like an ulcer or infection. In severe cases, untreated infections could lead to more drastic measures, like amputation. That's why it's so important to pay attention to any numbness or tingling in your feet and take it as a warning sign. If you notice these symptoms, it's a good idea to see your healthcare provider and have them check your feet regularly. Sign number 2. Burning or sharp pain. Another sign of diabetic nerve damage is a burning or sharp, stabbing pain in the feet, and it can be particularly troublesome at night. This type of pain is often linked to peripheral neuropathy, which is when the nerves outside your brain and spinal cord, like those in your feet, become damaged due to high blood sugar levels. People often describe it as a sensation of walking on hot coals or sharp, electric-like jolts that can make it hard to sleep. The pain may come and go, but it's usually more intense at night, disrupting your rest and quality of life. If you're feeling this type of pain, it's important not to ignore it. It's a sign that the nerves in your feet are struggling and need attention. Over time, untreated nerve damage can lead to a loss of feeling, putting you at greater risk for unnoticed injuries or infections. Talking to a healthcare provider is key. They can suggest treatments that may help manage the pain and prevent further damage. By addressing the symptoms early, you can improve your comfort and avoid more serious complications down the road. Sign number 3. Cold feet. Cold feet, even in warm environments, can be a sign of poor circulation, which is a common complication of diabetes. When blood sugar levels are consistently high, it can damage the blood vessels and restrict blood flow to certain areas of the body, especially the feet. This reduced circulation means your feet may not be getting the oxygen and nutrients they need, leading to a cold sensation. What's tricky is that cold feet caused by poor circulation may not always feel painful, but it's still an important sign that something's off. If your feet feel cold to the touch, or you notice a consistent cold sensation that doesn't seem to match the temperature of the room, it could indicate that your blood isn't flowing as efficiently as it should be. Over time, poor circulation can also delay healing, which means if you get a cut or sore, it could take much longer to recover and be more prone to infection. If you're experiencing cold feet, it's worth bringing up with your healthcare provider. They can assess your circulation and suggest ways to improve blood flow, like managing your blood sugar levels, regular exercise, or even medications if necessary. Sign number 6. Slow healing sores. One of the more serious signs of diabetes complications is slow healing sores on the feet. When blood sugar levels are high, it not only damages nerves but also affects blood vessels, leading to poor circulation. This reduced blood flow means that wounds, cuts, or even blisters on the feet don't receive enough oxygen and nutrients to heal properly. So what would normally be a minor cut can take weeks or even months to heal. High blood sugar also weakens the immune system, making it harder for your body to fight off infections. So a small sore that doesn't heal properly can quickly become infected, leading to more serious issues like ulcers. In severe cases, untreated foot ulcers can cause deep infections, potentially leading to tissue damage or even the need for amputation. That's why it's so important to regularly inspect your feet for any cuts, blisters, or sores, especially if you have diabetes. If you notice any wounds that aren't healing as quickly as they should, don't wait. See your healthcare provider right away. Early treatment can help prevent infections and other complications, keeping your feet healthier in the long run. Sign number 5. Dry, cracked skin. Diabetes can affect the skin on your feet, making it dry, flaky, and prone to cracking. This happens because high blood sugar levels can lead to dehydration, pulling moisture away from the skin. Additionally, nerve damage from diabetes can affect the sweat glands, reducing the natural oils that keep your skin soft and moisturized. As a result, the skin on your feet can become extremely dry, which increases the risk of cracks. Cracked skin may seem like a minor issue, but it can be an open invitation for infections. Once the protective barrier of the skin is broken, bacteria can easily enter, leading to infections that are harder to treat in people with diabetes, especially with poor circulation. To prevent this, it's important to keep your feet moisturized. Apply a good lotion or cream daily to help keep the skin soft and hydrated, but avoid putting lotion between your toes. This area needs to stay dry because too much moisture there can create an environment for fungal infections. Keeping up with a simple foot care routine can go a long way in protecting your feet from complications caused by diabetes, like cracked skin or infections. Sign number 6. Foot deformities. Charcot foot. Charcot foot is a serious but lesser-known complication of diabetes. It happens when the bones in the feet become weakened due to diabetic nerve damage, a condition known as neuropathy. Because neuropathy reduces sensation, people with Charcot foot may not feel pain from fractures or injuries in their feet. As a result, they may continue to walk on the weakened bones, which can lead to further damage and deformities over time. Early signs of Charcot foot include redness, warmth, and swelling in the affected foot. These symptoms might look similar to an infection, but in this case, they're actually due to the bones shifting and collapsing. If left untreated, Charcot foot can cause the shape of the foot to change dramatically, often developing a rocker bottom appearance or other structural deformities. This can make it difficult to walk and may lead to ulcers, infections, or even the need for amputation. If you notice any signs of swelling, redness, or unusual warmth in your foot, it's crucial to see a healthcare provider immediately. Early intervention, such as immobilizing the foot, can help prevent further damage and protect the foot's structure, reducing the risk of long-term complications. Sign number 7. Loss of hair on feet or toes. One subtle yet significant sign of compromised circulation in people with diabetes is hair loss on the feet or toes. When blood flow decreases due to high blood sugar levels, the body struggles to supply essential nutrients and oxygen to the extremities. As a result, hair follicles in these areas may become less active, leading to thinning hair or complete hair loss on the feet and toes. This change is often overlooked because it may seem minor compared to other, more obvious symptoms. However, it serves as an important indicator that your blood circulation might be impaired. Healthy blood flow is crucial not only for hair growth, but also for overall foot health. When circulation is compromised, your feet become more vulnerable to injuries, slow-healing sores, and infections. If you notice a decrease in hair on your feet or toes, it's a good idea to discuss it with your healthcare provider. This can be a key sign of underlying vascular issues that need attention. By addressing circulation problems early, you can help prevent more serious complications related to diabetes and maintain better overall foot health. We've covered some critical signs your feet may show regarding diabetes complications: numbness or tingling, burning pain, cold feet, slow healing sores, dry cracked skin, foot deformities like Charcot foot, loss of hair on the feet, and slow healing sores. It's essential to check your feet regularly for any changes or symptoms, and to seek medical advice if you notice anything unusual. If you or someone you know is experiencing any of these signs, don't wait. Consult a healthcare professional today. Early detection can save your feet and significantly improve your quality of life. Thank you for watching. If you found this information helpful, please share this video with others. Together we can promote awareness, BTS awareness, and better health for everyone.